It's time for Ask Dr. Ryu with Dr. Ryu Sang-hyo. Good morning. Happy birthday.
Oh, really? How'd you know that? Thank you.
Because the little birdie in the studio, she let me know, and we played that song for you.
Wow, it's a top secret.
No. So you're turning what, like 29?
Oh, yeah. 29.
So happy birthday to 오빠님.
Oh, thank you so much. And thanks my parents, my mommy, and also thank God. And then I wish I could live to the fullest until I die. Anyhow, I was so...
Until I die?
Yes, I was so, corny. Anyhow.
Yes.
How are you today?
I'm doing okay. I want your take on our text topic. Mm-hmm. What is something that is very indicative of your generation?
Okay, like I said, I was... now I'm turning 29, so I'm going to tell you my own story when I was in high school and middle school in college. Okay, my generation, the private tutoring was banned.
Oh, it was banned?
Yes.
가외 금지?
Yeah.
Ah.
And also, there are a lot of things popping in my mind. After school, on my way home, there were a lot of street vendors, especially tteokbokki vendors and some other
street food vendors.
Street food vendors, and also some other stalls selling 그 학용품들 파는 것도 있었고요.
학용품도요?
Yeah, that's right.
School supplies.
Yeah. Also, I after school I go to 만화방 with my friends, and also video game room.
Ah, yes.
Yeah, that's what I did.
So it wasn't just about studying for you. Not really.
Not really. Study has nothing to do with. It was nothing to do with me. No wonder I failed the college entrance exam 5 times. And speaking of exam,
yes.
In order to move from middle school to high school,
yes,
we need to take another test.
And like an entrance exam,
yes,
right?
Entrance exam. High school entrance exam. Then college entrance exam.
Oh my gosh, exam after exam.
Yeah, exam after exam.
That's your generation, right?
Yeah, that's my generation. And also,
yes,
I should mention this one. My favorite singer-songwriter, AMJ, Michael Jackson.
That is very indicative of your generation. So thank you. And Leslie says, Dr. Du looks younger every week. We need a skincare routine. 우리 한번 skincare 해야 되겠어요, Dr. Du. They're saying you look younger every week.
Thank you so much. I put some kind of a BB cream. And also, I have to confess, I draw my eyebrow a little bit. Yeah, that's what I do.
It looks very natural.
Thank you so much. And the screen kind of adjustments of the colors. Yeah. Don't fall for this one. It's all...
It's a facade? No.
It's all, how can I fabricate it?
Yes, well, we do appreciate it.
Thank you.
We want to dive into our topic today for Ask Dr. Du. So what are we talking about?
Okay, last week I was talking about sleep-related issues.
Yes.
But I prepare some more interesting topics for you guys.
Ooh.
So this is going to be our second part of our sleep, because sleep is one of those specialties doctors, as a neurologist,
yes,
we cover every day.
So this is like part 2.
Yes, this is like part 2.
Okay.
So many of us are having sleep problems. This is hot weather.
Yes. It's hot.
Yeah.
It's hard to stay asleep
Yeah.
with, like, if you don't have the AC on or the fan on. 저도 at least once a night, I tend to wake up if it's too hot, right?
That's right. And you know what? Surprisingly, hot weather, hot environment during sleep is to do with nightmares.
Nightmares.
Yes, right.
Oh, okay.
So if you are having nightmares, and then you gotta check out the room temperature while you're sleeping.
I see.
Yeah. And also, I'm gonna talk about again because it's really important, because of sleep apnea.
Yes.
Sleep apnea is a big deal for our health, because everybody knows what snoring is. Snoring is like it's a snoring.
Yes.
But sleep apnea is like when you snore, your breath stops. Like, it's like gasping. And then after taking a pause, maybe 1 or 2 or 3 seconds,
yes,
Yeah.
You're so good with the with the sound effects today.
Yeah, that's my another 개인기. Anyhow, that's sleep apnea. It poses very serious health risks.
So in Korean, I looked it up. Tell me if I'm wrong. Is sleep apnea 수면무호흡증? Is that correct?
Exactly.
Okay, just so our listeners are better aware of sleep apnea, what this is. Okay.
Yes, that's right. 이게 무호흡이 되면은, so when our body
Yes.
doesn't take oxygen enough to supply our brain nutrients and oxygen, our brain cells die slowly.
Oh no.
And our heart is under a lot of stress. So they have to increase their blood pressure and our body turns on emergency mode. So that's why if you are having some kind of a sleep apnea for a while,
Yes.
and then you might put yourself into a danger of having high blood pressure, heart attack, and even stroke, and diabetes and memory problems, and also depressions might ensue.
This is serious.
Yeah. So whenever I see sleep apnea patients, many questions I ask, and that includes daytime sleepiness, and also the power of concentration during the
Yes.
day, and also it can cause male infertility as well.
Oh, that's bad.
Yeah, I have to ask. Is your thing working fine? And that kind of situations are caused by sleep apnea.
We have a listener, 태진, who says, Dr. Ryu, 저 잘 때 무호흡증이 있어서 몇 년 양압기 하고 자다가 지금은 귀찮아 그냥 자요. Is that okay? 그냥 자는 거. He used to, I guess, use some sort of 양압기. Can you
I
explain?
know.
What is that?
It's a continuous positive airway pressure.
Oh, okay.
Yeah. The reason why we experience this kind of sleep apnea is our airway gets blocked.
Blocked, right.
Yeah. As we get older, our airway passage, our airway passage consists of several anatomical factors.
Okay.
First, our uvula. Uvula, 목젖이죠.
네.
And also the diameter of your oral cavity and diameter of your airway passage, your pharynx
I
and
see.
larynx, and that parts.
Sure.
And under what circumstances those gets narrowed is when you get older,
Okay.
your tension, the muscle tension, it's sagging downwards.
Oh, that's so sad.
It's kind of one of those aging process.
Yes.
The other thing is obesity. Yeah. And all those things are combined together. And it's a positive airway pressure means it's a machine that hooks up to your nose and that machine gives off continuous positive pressure. So that's why it can prevent our airway from collapsing.
I see.
So during the night, when you take those kind of a CPAP to your mouth, it gives you a continuous airway pressure, and then it prevents our airway from collapsing. So you might have a really good night's sleep. But you stopped using it. But in that case, I ask this question: during the day, you have hard time concentrating on things that you want to do, or you feel really sleepy.
졸리거나 집중할 수
That's
있는지를
right.
물어보세요.
Yeah. If that doesn't affects you, in that case, you can wean off of the CPAP. But be careful if those symptoms like memory problems, depression, and if your your blood pressure goes up, and then check blood pressure, and then check your blood as well. If you're diabetic, in that case, you need to consider initiate this CPAP method.
Oh, well, thank you for answering Taejin's question. And then, of course, I do need to ask you.
Yes, sir.
So
I
if
see.
you have like snoring or sleep apnea, what about in terms of surgery? I've heard like there are surgical procedures. Does this help?
Yeah, it helps but it's not definitely because surgery is very temporary thing. You know, surprisingly, about more than 50% of those who have surgery,
Yes.
this sleep apnea recurs.
Oh, it comes back.
It comes back. So it's what I want to iterate is this one. Sleep apnea is not the one cure it all kind of a treatment options. It's a lifelong strategy. You have to maintain your body in a good shape and then exercise a lot to not try not to be obese.
Yes.
And also try to avoid booze, especially when you drink
Alcohol.
Alcohol. Your skins and your muscles gets really relaxed, and then it blocks your airway.
Okay.
So maintaining a really nice, good, healthy lifestyle is the paramount when it comes to maintain, getting rid of or stay healthy sleeping.
Yes. So, can we go through some of like the myths?
Yes.
Because I love how you kind of bust all the myths out there, right?
Yes. Here's the thing. There are many myths, but I'm going to pick out some important stuff. Exercise before bed ruins your sleep. Is it true or not?
I don't know. Does it? 피디님 says yes.
Yeah, it can be yes and no because some people some people who exercise at night and go to bed really well. But if your stress level goes up at night and then you work out at night and then it disturbs you with your sleeping pattern, in that case, no exercise before bed is recommended. No. But usually, excess kind of aggressive exercise is recommended in the morning rather than in the afternoon.
Okay.
And also another thing is sleeping in on weekends.
Yes.
Is best ways to catching up your.
Can you catch up on sleep? Is there such a thing? Like
No.
몰아자기요.
Actually, it's not true.
Not true. It's a myth.
That's the worst thing actually.
Oh.
Yeah.
Did you hear that audible gasp, everyone?
Yeah.
With no mic.
We have our own biological clock.
Yes.
Yeah, we have to maintain it. So on weekends, if you sleep in and then if you go at a wrong time and then sleep in the afternoon, it disrupts your total biological clock.
This one I totally agree with you on. Saturday, Sunday, my eyes fly open 4:30 a.m. But I'm okay.
Yeah, you're okay.
Everybody assume like, oh, you don't get enough sleep, and I'm like, no, but I feel okay.
Yeah.
Yes.
So that's why, if you sleep in on weekends, think of a Monday. That's the aftermath of that sleeping in tragedy kicks in.
Oh, so now we have to wrap up already. So we need your wisdom because you have grown older by 1 year. You're now 29. So what words of wisdom do you want to part on?
Okay. Make it steady, and consistency is the rule of thumb when it comes to maintaining your healthy lifestyle and also maintaining your future.
Yes.
That's the thing. So consistency matters. So keep at it.
Yes.
And sometimes you really need to get some really good sleep. Try not to sleep in.
Okay.
Rather, I want to go to bed early.
Okay.
So
okay.
that the waking up time is the most important thing.
Be consistent.
Yeah, be consistent.
Well, thank you for part 2 of this because, this is of concern to everybody out there. So we look forward to next week. And once again, happy birthday.
Oh, thank you. Thank you so much.
All right.